Okay, let me share my slide. So I have two lectures left with you. Today we'll do the prematurity and its complication. It should not be a lengthy lecture. Usually within 45 minutes we should end already. And again, I don't believe in lengthy lectures. The other lecture, which I think is more important, which is the transition to extrauterine life. Can we do it on Sunday morning? Sunday morning ke Saturday? Do I have anything Saturday? Let me see. Actually okay je. You nak buat Saturday ke Sunday? I prefer Sunday lah, but it's okay.
I think Saturday, few of us have programs. I think Sunday morning should be good.
Okay, alright. You all reconfirm with your colleagues semua. So kalau semua okay, we can do Sunday tu we can do morning lah. 8:30 is okay. Pergi breakfast kan Sunday tu. Ada yang pergi breakfast. Okay, alright. I hope, can you see my slide? Okay, today we are talking about prematurity and its complication. Okay. When we talk about a premature baby, you need to remember that human being, we are not like other animal. Some animal, when they are born, they already have the capability of many things. They can already walk, they can already run, kan? But human being, our development does not end by birth. Certain parts of our bodies, the development still continue years after we are being born. For example, lung maturity. When is our lung fully matured? Siapa boleh ada idea? Umur berapa? Actually, our lung fully matures well beyond our teenage years. Even 12 years old, there are still parts of our lung is still maturing. It takes 16 to 18 years for our lung to actually fully mature. It takes that long for the lung to mature. Our brain, even at birth, there are even many areas of the brain that is still not even there yet. The area that controls walking, strength of the hip, for example, they're still not there. So that is why the whole body is still developing. It's not just growing, it's also developing. Development and growth are two different things. So generally our brain, from intrauterine life until about 2 years old, the brain develops. Many structures are being formed, many structures are being apoptosed and dies off. So the brain is still developing. After 2 years old, the brain generally is growing rather than developing. It's mainly growing rather than developing after 2. In premature babies, in babies with babies who have problems, HIE, hypoxic ischemic encephalopathy, or many other neonatal problems, sometimes we do follow up the babies at least 2 years old. Babies with severe jaundice, those babies who are ventilated, ill babies, babies with newborn neonatal meningitis, for example. We follow up those babies until at least 2 years old, because we know by 2 years old is the time when the brain is actually developing. After 2 years old, it's growing. That's also a reason why we diagnose cerebral palsy after 2 years old. Because as you know, cerebral palsy is a problem in a developing brain. So the insult occurs less than 2 years old. After 2 years old, only then when the brain is not developing anymore, then only we diagnose as cerebral palsy. Because after 2 years old, the brain is growing. It's not actually developing anymore. So that's the core concept. And if you have a baby with prematurity, the problem with the baby is actually head to toe. The problem that can happen is head to toe. Head, the brain is still immature. There are many areas of the brain that is still not developed yet. For example, a baby who has hypoxic ischemic encephalopathy, baby who was born not crying, blue, kena ventilate, kena buat CPR apa semua. How do we know the long-term outcome? Will the baby be cerebral palsy? Can the baby walk? Before 2 years old, we have no idea. Why? Because certain areas of the brain are still developing. We don't know. Those are the problems. And then babies punya brain, babies punya body, dia ada especially the brain, dia ada something we call as neuroplasticity. So with neuroplasticity, the brain, even though it's damaged, sometimes it can still recover some of its function. So that's something interesting. Next is the brain. We know already the blood vessels of newborn babies, especially in the brain, is very fragile, it's very friable. Especially the more premature the baby. The more premature the baby, the more friable are the veins. The more friable are the vessels. Bila blood vessel dia friable, very fragile, dia senang jadi apa? Senang bleeding. Dia senang bleeding. Bila dia senang bleeding, dia jadilah what we call as intraventricular hemorrhage, IVH. Intraventricular hemorrhage. So, and IVH as well, we classify according to stages there. Okay. Dulu-dulu we used to classify as grade 1, grade 2, grade 3, grade 4 IVH. So grade 1 IVH is when there is the bleeding occurs around the ventricles of the brain. It can also be what we call as what's the term? Allahu Rabbi. Can't recall. So that's grade 1 IVH. Grade 2 IVH is when the bleeding, you can see the bleeding inside the ventricle, but the ventricles are not dilated. It's still normal size. Grade 3 IVH is when the bleeding is inside the ventricle and the ventricles are dilated because of the bleeding. Grade 4 IVH is when there is bleeding in the parenchymal bleeding. So parenchymal bleeding, so bleeding in the brain itself. So that's grade 4 IVH. Grade 1, grade 2 IVH are generally okay. There's no problem. A very good outcome. Prognosis is excellent. But grade 3 and grade 4 IVH, the prognosis is very, very bad. Usually, children with grade 3 and grade 4 IVH, they will have long-term neurological sequelae. Grade 4 IVH, almost all of them actually results in death. So that's the problem with IVH. They are also more prone to many other problems. For example, those babies who have a twin-to-twin transfusion, for example, twin-to-twin transfusion, lepas tu kita buat procedure. So sometimes they may have in utero or antenatal hypoxic insult. So those hypoxic insult, they may just certain parts of the brain. And those parts of the brain that is hypoxic, sometimes early on, lepas after birth, kita akan nampak some cystic changes. Nampak macam bulat. And all these cystic changes are the ones we call as periventricular, Allah Rabbi. I totally forgot the term, but we will go through it. It's in the slide. So we'll see some changes. So that's among the things in the brain. The brain as well, satu lagi adalah they are more porous as compared to more mature brain. So dia senang jadi cerebral edema. They can get cerebral edema very easily. Even with temperature irregularity, hypothermia, dia boleh dapat cerebral edema. Electrolytes abnormality, sodium, kan, rapid change in sodium, kan, from hyponatremia goes to hypernatremia. can cause cerebral edema. So that's the brain. The eyes, the vessels in the eyes are more friable, more sensitive. They are prone to get what we call as retinopathy of prematurity. Breathing kan? You remember breathing is controlled by kat mana? Where do we control our breathing? First I think first few physiology lecture year 1. It's in the pons kan? Dekat pons ada cardiorespiratory center. Kan? Your pons ada cardiorespiratory center, is connected. It got the impulses from the carotid body, aortic body. Kan? So carotid body, aortic body, they detect your PaO2 and PaCO2. Kan? It gives reflexes, give impulse to your pons, cardiorespiratory center in the pons. So the pons area in the premature babies, they are not mature. So bila they are not mature, sometimes they don't fire. Bila they don't fire, what happens is what we call as anemia of prematurity. So apnea of prematurity. Apnea of prematurity. So they don't breathe. They just forgot to breathe. Dia lupa nak bernafas tu. Tiba-tiba je baby tu okay, tiba-tiba they stop breathing. Not because they are unwell, it's just because their pons do not fire. Kan? They just this is what we call as apnea of prematurity. So apnea of prematurity kena treat lah. Sometimes kita bagi caffeine, caffeine. So caffeine yang you have in coffee, tea apa semua kan. So it's a very good stimulant. It's a very good stimulant. You know, caffeine can cause tachycardia, blah 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 semua kan. Okay, so they have apnea of prematurity. They may have problem with swallowing. Why? Because swallowing is not okay. They may have problem with sucking first. Sucking. Kenapa sucking? Sebab sucking, even though we think sucking is something simple, sucking is a type of primitive reflex. So all newborn babies, they should have certain primitive reflexes. Nanti bila kita belajar pasal newborn examination, we'll teach you about primitive reflexes. So primitive reflexes are macam knee-jerk reflex. So these are deep tendon reflexes. So primitive reflexes are reflexes that are basically important to make sure the child survives. And among there are banyak primitive reflexes are Moro's reflex, sucking, rooting reflex, blah blah blah. So ada banyak. So among them is actually sucking reflex. Whatever you put inside the child's mouth, dia akan suck. That is primitive reflex. One of the primitive reflex. There is rooting reflex. You stroke dekat cheek dia akan cari. So that is primitive reflex. So they should have sucking reflex. But the problem with premature babies is that sucking reflex okay, so sucking reflex appear around 34 weeks. 34 weeks period of gestation. So before 34 weeks, usually sucking reflex too is still not there. Maknanya if we try to give feeding orally, baby tu memang tak boleh suck lah. So sucking reflex is not there. So sucking reflex appear after 34 weeks. So they may have, bila tak boleh suck, macam mana nak swallow. And swallowing juga is not an easy punya benda. It's not an easy process. We think swallowing senang kan? You masuk benda dalam mulut, telan. Air liur pun you senang boleh swallow. But swallowing is actually a very complex punya process. Kan? You need to control your breathing. You punya epiglottis kena tutup. Your punya epiglottis must be able to differentiate between fluid, solid, semi-solid, and also air. So that is a complex punya mechanism untuk make sure that air goes into the lungs, other things goes into the esophagus. So that's a very complex mechanism. They must have a mature mature musculature of your cheek, mature musculature of your tongue, mature musculature of the epiglottis, glottis, mature musculature of the esophagus to actually push whatever that you ingest. Sebab tu they can swallow in space, kan? Sebab movement of food particle tu is not just by gravity, kan? Sebab tu you baring pun you still boleh telan. Kan? Astronauts dekat space dia still boleh telan. Sebab swallowing tu occurs actually by peristalsis. So this peristalsis movement needs a mature punya musculature of the esophagus. So this may have problem with in premature babies. They may have problem with swallowing. They may also have swallowing discoordination or swallowing incoordination. Swallowing incoordination tu maknanya apa? Maknanya dia punya sucking dia okay, esophagus dia okay, peristalsis dia okay. Tapi they have problem in coordinating the epiglottis and so on so forth. So dia boleh telan, dia boleh suck, dia boleh apa, tapi dia ada discoordination. Bila ada discoordination, they may have frequent aspiration pneumonia, for example. So that's the sucking and swallowing. Their lungs are immature as well. Apa problem dekat lungs dia? Dia punya lungs, we need our surfactant. Okay, surfactant is produced by which type of cell?
Type 2.
Which type 2 pneumocyte. So surfactant are produced, betul lah, type 2 pneumocyte. Betul lah. So surfactant are produced by type 2 pneumocytes. And this type 2 pneumocytes, they start to produce masa umur berapa? Umur berapa baru dia start keluarkan type 2 pneumocytes? Some may happen as early as 28 weeks, but generally around 34 weeks. Generally around 34, 36 weeks. So before that, the lungs may not have enough surfactant. Bila they don't have enough surfactant, the lung may collapse. The lung may collapse. Bila lung collapse, it causes respiratory distress syndrome, RDS. It causes hyaline membrane disease. Yeah. So they need help in terms of ventilation, kena bagi surfactant and so on so forth. Dia punya heart dia still immature. Dia punya heart dia still, nanti masa adaptation to extra uterine life we'll discuss about the heart. What are the changes? So the heart are still immature. Bila heart is still immature, dia senang, the PDA may not close. The foramen ovale may not close. So pattern foramen ovale can cause this problem. Pattern ductus arteriosus may cause this problem. So the heart is still immature. The gut as well is still immature. Bila the gut is still immature, peristalsis tak bagus. So they may have problem with feeding. Yeah, dia ada feeding intolerance. Sebab apa? Sebab gut is still immature. Masuk stomach dia tak move, tak ada peristalsis. So sometimes kita kena bagi prokinetic punya medication macam erythromycin ethyl succinate, ES. So ES is among the prokinetic yang kita boleh guna. Dia punya pyloric sphincter as well. Dia punya cardiac sphincter, bukan pyloric sphincter. Cardiac sphincter may be not strong enough. Bila dia punya cardiac sphincter is not strong enough, what will happen? They may have more reflux. They may have gastroesophageal reflux disease. Kan? So kita kena, many premature babies, kita kena bagi some anti-reflux punya medication. Dia punya gut, bawah tu pun semua still immature. Bila gut semua still immature, dia blood vessel dia still friable, they are immunocompromised. Dia pula tak ada normal gut flora dalam dia punya gut dia. So bila tak ada benda macam tu, they are more prone for gut punya infection. For example, yang kita paling worry of is necrotizing enterocolitis, NEC. So NEC is a known risk, especially in prematurity. The main risk factor for NEC is actually prematurity. Prematurity is the main risk factor for NEC, necrotizing enterocolitis. And NEC, 30% risk of mortality, very high risk of mortality. And how to prevent NEC? By breastfeeding and breast milk. Sebab breast milk ni, studies have shown, breast milk will actually reduce the risk of NEC and more tolerable. Sebab apa? Sebab dia punya whey calcium ratio dia. Gut senang nak absorb. Dia punya, it affects the DNA of the lining of the bowel, for example. Breast milk juga is a good prebiotic, and prebiotic maknanya it creates an environment that is good for normal flora to grow. for good bacteria to grow. That's prebiotic. Dia juga dalam breast milk juga ada probiotic. So probiotic apa? Probiotic are good bacteria. Macam apa? Macam lactobacillus, macam bifidobacteria. So all these are probiotic. So probiotic actually prevents the bad bacteria to actually grow and cause NEC and so on and so forth. Premature babies, they are admitted in NICU. Bila they admitted in NICU, they are more prone to get infection daripada NICU. Kan? Kuman macam Klebsiella, they are not usually, kalau dekat community, they are not that problematic. Tapi dalam NICU, they are more prone to get serious multi-drug resistant punya organism macam Acinetobacter, certain types of Klebsiella, for example, Pseudomonas. All these are more difficult to treat punya bacteria. Their blood as well, bone marrow, kan? Their bone marrow are not mature enough yet, so they don't produce much blood product. Semualah daripada hemoglobin, daripada red blood cell kepada white blood cell kepada platelet, they are more prone to get what we call as anemia of prematurity. Anemia of prematurity ni sebab apa? It's a multifactorial. Satunya sebab iron content dia rendah. Kenapa iron content dia rendah? Sebab iron is stored in the liver. Their liver pun immature. Kan? Juga apa? Juga iron dia dapat daripada mana? Dia dapat from the mother. Kan? Kalau term babies, dia ada 40 weeks untuk dapat iron daripada mother. Tapi kalau premature babies, dia dapat less than 36 weeks untuk dia dapat iron. So they don't have enough iron storage. Itu nombor satu. Nombor dua juga, dia kecil. Kita kena ambil darah. Dia masuk NICU. Sekali ambil darah, 2 ml, 3 ml, 10 ml ambil darah. Kan? Our blood dalam kita punya body berapa banyak? Blood kita around 80 mils per kilo. Kan? 80 ml per kilo. That's our blood volume in our body. So kalau baby tu 500 gram, kan? Dia 80 mils per kilo. Kalau baby tu 500 gram, berapa banyak total blood volume dia ada? Only 500 ml. 500 ml. So kalau sekali ambil darah, kita ambil 10 ml. Kan? Isn't that a lot? Kan? That is seriously a lot. Kan? So benda macam tu. Kan? So they are prone to get anemia of prematurity. I mentioned before, dia ada the liver is immature, so they tend to get jaundice more. They can get coagulopathy of prematurity. Sebab apa coagulopathy? Sebab liver is immature. Kan? Dia juga boleh dapat apa lagi? Dia juga boleh, dia punya immune system. Kenapa immune system they are considered as immunocompromised? Kenapa? Why? Sebabnya satu, they cannot produce their own antibody efficiently. Sebab itu newborn baby, they don't get all this host antigen reaction ni. Dia tak dapat macam transfusion reaction. They don't get all those kinds of reaction. Sebab apa? Dia punya immune system is still immature. Sebab tu bila dia orang dapat COVID, newborn babies, they don't get the serious punya complication of COVID because their immune system is immature. Kan? So they don't get all the immune yang adults boleh dapat sebab their immune system is immature. Newborn babies, they can die from simple infection macam chickenpox. I've seen varicella pneumonitis. I've seen varicella encephalitis causing death in newborn babies. So apa? Sebab their immune system is immature. Kan? They don't have that. And adults, okay, so term babies, mana dia nak dapat antibody? Among them is from the mother. Macam mana nak dapat antibody daripada mother? Ada dua cara. Satu is vertical transmission. Macam mana dapat vertical transmission? Vertical transmission dapat melalui cross placenta, vertical transmission. So maknanya sebab itu certain mothers kan, kita bagi contohnya kalau dekat UK, pregnant mothers are given vaccination. Dia bagi DPT vaccine, for example, untuk prevent diphtheria, pertussis, tetanus apa semua. Dia bagi masa pregnant. Sebab apa? Sebab mother will produce more antibody masa tu, and those antibodies will cross into the baby. Kan? Cumanya usually IgM does not cross into baby. IgG crosses into baby. Sebab IgM ni besar. Kan? IgM besar, IgG smaller particle. Certain IgM crosses placenta. Contohnya macam dengue IgM. Dengue IgM crosses placenta. Most IgM do not cross placenta. IgG boleh cross placenta. But crossing of immunoglobulin daripada mother to baby through the placenta occurs around 24-25 weeks. Around 24. So kalau baby is born at 25 weeks, mana dia nak dapat all the IgG? Kan? So dia tak ada IgG, dia tak boleh produce diri sendiri, and they don't get from mother. So they are immunocompromised. So dia tak dapat those immunoglobulin daripada mother, and even if they are born at 30 weeks, they don't have enough from the mother. Apa lagi source dia boleh dapat? Satu, I said vertical. Satu lagi, there's horizontal transmission of antibody. Apa yang dapat through horizontal? Siapa boleh bagi idea? Macam mana baby boleh dapat horizontal transmission of immunoglobulin ni? Siapa boleh bagi idea?
Breastfeeding.
Breastfeeding, yes. What type of immunoglobulin? What type of immunoglobulin ada dalam susu ibu? Secretory?
IG.
Apa antibody? Apa?
IgA.
IgA lah. Dia ada IgA, IgG, IgE. So IgE ni yang macam asma, benda-benda tu kan. So kena tahulah. So IgM ni yang tak ada memory, that's innate punya kan. IgG ni yang ada memory. So IgA ni yang dapat daripada secretory. Daripada mana? Daripada breast milk kan. So those are secretory IgA. So baby boleh dapat IgA daripada breast milk. This is the most superior punya milk available sebab ada IgA. Kan? Sebab ada IgA. And that IgA juga studies have shown susu ibu ni, breast milk ni, bila baby unwell, mother punya milk always automatic dia akan higher IgA, higher white blood cell to actually help the baby to fight infection. So dia dapat IgA daripada mother. This is for term babies, but for premature babies, what's the problem? They cannot suck. They don't know how to swallow. So dia feeding pun pakai rice tube. Bila dia feeding pakai rice tube pula kadang dia unwell, dia kena NAC, NBM lama-lama. So mana dia nak dapat IgA tu? Lepas tu mother pula separated from baby. Mother separated from baby, dia punya breast milk production pun tak bagus sangat. So mother don't have milk. That is why IIUM under Sultan Ahmad Shah Medical Center, Fasmi IIUM ni, we introduce our Halimatul Sa'adiyah Mother's Milk Center. Kan? Because this is the first human milk bank in Malaysia. It's the second Syariah compliant human milk bank in the whole world. Why? Because if you look at fatwas, if you look at even the biggest contemporary ulama who died last year, 2 years ago, kan? Prof. Wahbah Az-Zuhaili, in his book Fiqhul Islami wa Adillatuh, what's the translation? Fiqh Islami wa Adillatuh. So he mentioned that formation of milk bank ni. So he mentioned that donation of milk is permissible and is encouraged because we know our Prophet Muhammad breastfed from at least 3 mothers, breastfed from at least 3 different donor mothers. So our Prophet breastfed from 4 mothers, including his own mother, kan? Aminah, and he breastfed from 3 other donor mothers. But the most famous is Halimatul Sa'adiyah lah, kan? So is encouraged. Is encouraged to donate milk. But he said because of the issue surrounding radha'ah, surrounding milk kinship, anak susuan. So he said because of that, formation of human milk bank is haram, is not permissible. If you look at fatwas, Malaysian fatwas as well, there's a lot of fatwas saying that formation of human milk bank is haram, it's not permissible. Can you guys hear me clearly tak? So I saw gambar yang macam stuck. Clear?
Yes.
Kau ada stuck tadi?
Clear, Doktor, clear.
Clear, Doctor.
Right. So fatwa kata tak. But what we did for the past 2 years and more, actually we have met many times with the muftis and so on and so forth. We made lots of movement, lots of discussion, and finally Majlis Fatwa Pahang has already published, not a fatwa lah, but publish a paper that is given by us, and they now allow formation of mukbang. So that's what we have established in SASMAC. The first mukbang in Malaysia, the second Sharia compliant human mukbang in the whole world. The first is in Singapore, KK Women Children Hospital in Singapore. But we don't agree with how they are doing things lah. But okay, so that's what we do because we want to save newborn babies, because studies have shown newborn babies who got breast milk have much lower risk of NEC. They have better IQ, for example. They have better EQ. There's a lot of benefits of breast milk. So what I'm trying to say is newborn babies, they are immunocompromised. Their immune system are more immature. Their kidneys are immature as well. Bila their kidneys are immature, they may have 2 different problems which may happen consecutively. Usually all babies, the first 24 hours, they have oliguria. They don't pass urine. They don't pass urine. And especially in premature babies, the oliguria can be more severe. They even have anuria for the first 24 hours. Then they will go to polyuria. Maksudnya bermula tak pass urine, tiba-tiba suddenly pouring out of urine. So bila dia pouring of urine tu, daripada mula-mula dia boleh edematous, boleh overfill, lepas tu terus jadi underfill, terus jadi under volume sebab polyuria. So that's the difficult thing. So bila dia ada renal, bila the kidneys are immature, they have problem with drug excretion, for example. Sebab itu certain antibiotics macam gentamicin, macam vancomycin, macam cephalosporins, we have a different dose for premature babies. Sebab apa? Sebab they don't excrete well. The drug excretion are not that well because the kidneys are immature. So the problem is head to toe. The skins are immature. Kan kulit dia, if you see premature babies, the skin are very fragile. Very fragile. Sometimes skin dia tu, you tengok skin dia macam malaikat lah, boleh nampak blood vessel kan. So in more premature babies, their skin are sometimes transparent. You can see blood vessels. So because they are very fibrous. So the skin is the biggest defense system that we have kan. So when the skin is very immature, very fragile, they are more at risk to get infection. And again, they are exposed in the hospital. Dalam hospital ni, you don't have the normal common cells, normal bacteria, normal organisms. Kan, if you learn about hygiene theory, blah blah blah. So if you don't get good organisms, your body will not produce adequate immune system. So when they are in NICU, they are exposed to certain NICU punya organism which is more dangerous. When they are in NICU, kita ambil darah. Setiap kali kita prick blood, we are exposing the child to infection. And kita ambil darah pula, we are exposing the child to anemia because kita ambil darah kan. So ambil banyak. So they are at risk of all those problems in NICU. Okay. Habis dah. Tak masuk slide lagi. So basically those are the gist. That's everything what I'm trying to say. Let's go to the slides quickly. 5 minutes boleh habis ni. Okay, some definition. So which babies we call as premature babies? So preterm babies or premature babies are infants born before 37 completed weeks of gestation. So as long as they are born until 36 plus 6, they are considered as premature babies. 37 weeks and onwards, they are called as term babies. So a rather newer type of sorry. A newer type of classification is the late preterm, which is 34-36 weeks. Moderate preterm are 32 and 36 weeks, and very preterm are those born before 32 weeks completed week of gestation. And those born before 30 weeks of gestation, they are called as extremely premature preterm. Extremely premature preterm. And then we also classify according to the weight. So from the weight is low birth weight, very low birth weight, and extremely low birth weight. So low birth weight less than 2.5 kilos, VLBWs are less than 1.5 kilos, ELBWs are born less than 1 kilo. So if you look at gestational age and the weight of the baby in Malaysia, generally most hospitals in Malaysia we consider survival. Survival is above 25 weeks period of gestation. So if the baby is born before 25 weeks, they are considered as abortion. And birth weight, most hospital takes 500 grams. 500 grams. So kalau baby is born less than 500 grams, they don't survive. They won't even go into NICU. Pediatric will not even see. Will allow the baby to die with the mother. So we don't even take the baby away. So in Malaysia, most 25 weeks and 500 grams. Some hospital in Malaysia takes 27 weeks. For example, there's one hospital in Kota Baru take 27 weeks. So babies born less than 27 weeks, they don't survive. And they take 750 grams. So babies born less than 750, they don't survive. If you go to more developed countries, such as when I was in UK, they take 24 weeks, up to 24 weeks. So less than 24, don't survive. No, in UK, they take 24 weeks, will survive. 23 to 24 weeks, they look at how's the baby condition at birth. Condition dia okay, the baby may survive, but if not, they won't do anything much. Less than 22, memang cannot survive. If you go for more developed countries, contohnya macam Canada dekat Toronto, or you go to Japan, these are among the most advanced neonatal punya country. So Canada and also Japan, they take up to 22 weeks. So as early as 22 weeks, they have 300 grams. The smallest baby I have personally handled is born at 350 grams. 350 grams, very small, very small. The earliest I've handled is actually 23 weeks lah, 23 weeks. So extremely premature baby. But in Malaysia, suspect, I think our youngest is 25 weeks. Suspect, our youngest. And our smallest is actually, I think, 550 grams. So most of those born less than 1 kilos are 99% are premature babies. 63% of those born 1 kilo to 2.5 kilos are premature babies. And then premature babies are also overlap. There's a lot of overlapping between low birth weight and also prematurity and with birth defect. So quite a significant number of babies born premature has also birth defect and so on and so forth. So this is data in the US lah. We're not going to go there. Basically, number of premature birth are increasing. Even in Malaysia as well, numbers of prematurity are increasing in trend. Why they are increasing? Because we are having better care. Before that, we don't have good antenatal care for the mothers, but now our antenatal care are much better, so more premature babies survive. Even there are even discussion for things like why there are many fatwas do not consider about express breast milk. They don't consider about many issues relating to newborn babies, kan? The answer is actually because previously premature babies don't survive. When premature babies don't survive, they don't have all the problems of prematurity. So premature babies survive when we have incubators. Premature babies survive when we have ventilators. Premature babies survive when we have surfactant, when we have antibiotics, when we have central lines. Before that, premature babies do not survive. Before that, premature babies do not survive. If you look at the incubator, the first time they introduce incubators for babies, where we can have better thermoregulation, actually they put babies dalam glass punya containers, and the first event, actually babies jadi macam zoo tau. Orang tengok, oh, the very small babies, it's like a exhibit. Sampailah when they saw that, oh, even small babies, when they put in incubators, they maintain thermoregulation, these babies can survive. Baru diguna dekat hospitals. So this is this is part of the history. And even if you look at breast milk, why there's not much fatwa about express breast milk before? Why the old Islamic scholars do not talk about express breast milk? Well, because if they express breast milk, they don't have any place to store. Nak store macam mana? Tak ada peti sejuk, kan? So when they can only store when they have proper cooling. So that's why old fatwas do not talk about all these things. So only contemporary fatwas talk about all these kind of things. Okay, we're not going to go there. We're not going to go there. We're not going to go there. There's a lot of issue with ethnicity as well, socioeconomic status as well. Low socioeconomic status associated with prematurity. The problem with prematurity is that the cost involved. The cost involved with prematurity is expensive. If you look at SASMAC, for example, you look at NICU. If you compare with other wards, NICU must be fully air conditioned. Kena ada HEPA filter. The cost is extremely high. I have one baby, born at 29-week periods of gestation. A very small baby, 800 grams. But the baby was admitted for 3 months. The baby was admitted for 3 months, and because the baby is under our private care, under private wing. Baby admitted for 3 months under private, so I can see the bill. You know how much the bill for that baby for 3 months stay? The bill is 170,000, 170,000 for 3 months stay. Can you imagine? Well, that is money earned for IIUM lah. Kan? And UIA bukan pelik kat kita pun. Walaupun we got them 170,000. Kan? So, but it costs that much. And we have babies, I have babies who stay in the unit for 10 months, 11 months in the hospital. So the cost is skyrocket, is extremely high. The cost for the hospital is extremely high. And SASMAC since last year has been extremely brave, which I am surprised as well. They are giving for all children up to 18 years old free of charge. So whatever things we give to the baby, to the patient, is free until 18 years old. I don't know how long UIA can sustain lah. But we'll see. So the cost is extremely high. Surfactant, kan? Sometimes certain babies we give 2 bottles of surfactant, and each bottle of surfactant costs thousands of ringgit each bottle, kan? So it's very, very expensive, very, very, very expensive. When I was in UK, for each baby, because dekat UK dia tak ada hospital government, dia tak ada. There's no government hospital. Each hospital is a different foundation. Each hospital is run by foundation. Cuma is how they charge the patient. So other patient, the cost is paid by insurance or paid by the patient themselves. So these are private patient. Same hospital, same doctor, same level of care. But the one that pays is the patient itself by insurance. So these are private patient. Majority of patient are NHS punya patient. Government bayar. But the charge is the same. So for babies who are admitted in NICU, the charge is £1,500 per day. Kalau you compute dalam ringgit, it's times 6.5. So almost 10,000 per day, 10,000 ringgit per day. And again, we have babies who are admitted for 1 year, 10 months, 11 months. I had babies, I think the eldest I've had babies daripada ni, that babies dalam NICU ni is I think 14 months. 14 bulan. Kita round, dia follow round. Dia follow ikut round. So they are very, very small babies. So the cost is extremely high. The cost is extremely high. Okay, we're not going to go there. Hospital charges, blah, 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 blah. So the point I'm trying to say is the cost for the babies in NICU is very, very high. And it's not just in NICU, there's also long-term care punya cost. Dia kena ada physiotherapy, kena ada community punya pediatrics. Sometimes they may have support, occupational therapy, dietitian, dietary support. There's a lot of things. And again, as I said, we follow up the babies at least until 2 years old. So follow up costs and so on and so forth. And there's a lot of issue. Many people think that the babies are meant to be and cannot be prevented, which is not true. There are many things that we can do to actually prevent premature birth. To prevent premature birth. And it starts with understanding the risk factor. It can be genetic, it can be environmental, it can be other interaction as well. So premature birth is the #1 cause of neonatal mortality and is the second cause of infant mortality in the US. Okay, let's go there. As I said before, as a premature baby, the problem is head to toe. It can be neonatal problem, short-term or long-term problem. Short-term, in the neonatal period, they are born with respiratory problem. They can have respiratory distress syndrome because of the surfactant insufficiency. They may have intraventricular hemorrhage or periventricular leukomalacia. This is because of hypoxic insult on the brain. So ada part of the brain become apoptosis. So dia akan replace with the dia akan jadi leukomalacia. Dia akan jadi cystic changes. Dia akan nampak white dulu. So this is periventricular leukomalacia. Periventricular leukomalacia is associated with significant long-term neurological sequelae. So I have babies with paraparesis, for example, because of periventricular leukomalacia. Necrotizing enterocolitis with 30% risk of mortality. So very, very high risk. Patent ductus arteriosus that can result in prolonged ventilation, can result in cardiac failure and so on and so forth. They are more at risk of infection because of the immune system is immature. They may have metabolic abnormalities such as what? Such as rickets of prematurity. So rickets of prematurity, apa? Phosphate dia low, calcium dia low. They may have all the rickets punya problem lah. Bent knee, they may have alkaline phosphatase, they may be very elevated. You akan nampak rickety rosary and so on and so forth. Rickety rosary is very favorite question for exam. They may have nutritional deficiency, iron deficiency, anemia, and so on and so forth. Short term, they may have problem with feeding, as I said before, because they don't swallow, they can't suck. So they may need feeding with rice tube. And we do have patients who are discharged on rice tube feeding. They may have growth problems. Sebab apa? Sebab kejap tak sihat, kejap dalam hospital. So they don't have enough nutrition, they don't grow really well. Infection in the hospital, apnea of prematurity, they may have neurodevelopmental problems because of all the intraventricular hemorrhage, because of PVL, and also because kalau duduk lama dalam hospital, most of the time they are on their bed. So dia tak ada exposure to the outside environment. So dia tak play, dia tak ada nampak all the stimulation and so on and so forth. They may have neurodevelopmental problem. They may have retinopathy of prematurity. So how they get retinopathy of prematurity? Previously kita postulated because apa? Because bila kita resuscitate baby, bila kita ventilate baby, kita bagi high oxygen. And oxygen is a free radical. It causes apoptosis. Kan? So because of oxygen. And also high oxygen, then suddenly kita drop oxygen level. Bila kita drop oxygen, this is the cause for retinopathy of prematurity. But when we go through all the literature, the main single most important cause of retinopathy of prematurity is actually prematurity itself. Bukan oxygen. So the main cause is actually prematurity itself. And sometimes they may have transient dystonia. They may have dystonic features, but that's transient and don't cause much of a problem. Prematurity is also the main cause of cerebral palsy. They may have sensory deficit, sensory neural hearing loss, and so on and so forth. They may need special healthcare needs, incomplete catch-up growth, school difficulties, vaccine delay, and so on and so forth. Some babies may have chronic lung disease. We have a baby in the ward with chronic lung disease. Chronic lung disease maknanya apa? They still need long-term oxygen. We do have babies who are discharged home on oxygen therapy. Okay, all right. What are the conditions? They may be that causes prematurity, can be spontaneous, or they can sometimes there's clinically indicated. So we are the one that causes the baby to be born premature. Some ada mother punya problem, macam eclampsia, or the fetus is having problem, fetal distress, and so on and so forth. So these are the spontaneous risks for premature birth, preterm labor, PPROM, and so on and so forth. Indication, clinical indication for preterm deliveries, preeclampsia, eclampsia, fetal distress, IUGR, babies who are noted to be not growing well. Kalau kita biar je, baby tu akan die in vitro. Placenta abruption, and fetal demise as well. So extreme ages, extreme maternal age are associated with prematurity. Mothers who are less than 18 and more than 35, and low socioeconomic status, unmarried mothers, and also certain races as well. Okay, all right. I think that's it. And also other risk factor, multiple gestation, twins, multiple pregnancies, maternal infection, maternal stress, bleeding. COVID-19 is associated with premature delivery, and COVID-19 infection in mothers are associated with premature deliveries. Okay, all right. I think that's it. I'm not going to go through the other slides. You can get the slides later. Clear that? Any question? So the problem is head to toe, and all is because of the immature organs of the whole body. Okay, any question?
Doktor nak tanya,
Yep.
why unmarried is one of the risk factor for prematurity?
The cause is not really clear, but most likely is multifactorial. It could be they are having more risk of infection. Could be they are more at risk of. Generally, the cause is not sure. Sama juga. Kenapa extreme ages are more at risk of prematurity? We don't know. Why certain races are more. I think in Malaysia doesn't really, it's not significant, but in other countries sometimes they show that African American are more at risk. But why? We don't know. Probably related to lifestyle, probably related to type of diet, probably related to hygiene. We don't know. Sama juga, kenapa orang miskin, low socioeconomic status, more associated with prematurity? We don't know. Probably nutrition, probably hygiene, probably lifestyle. We don't know.
Okay, thank you, Doctor.
Okay. Any other question? Clear? Okay lah. Cukup lah. I think that's it. If you guys have another question, then we can discuss later. Tomorrow we'll have our session on this Sunday. Okay. Cuma nanti I would suggest, if you all want lah, we can have a session with the whole group. If you want to do with the students in other department pun boleh juga. If you want, we can do a virtual online punya session where we can discuss about certain pathophysiology of common problems in pediatrics. Because I always emphasize that if you understand pathophysiology, you can understand the presentation, you can understand how the history, you can understand the investigation to do, you can understand the management if you understand the pathophysiology. So if you want, we can discuss about pathophysiology of common presentation in respiratory, cardiovascular, and renal. I always like to talk about all those things. If you want, we can arrange, we can do the whole group, or even the other posting as well. Okay, all right. We'll see how. Okay. Assalamualaikum warahmatullahi wabarakatuh. Let's end with us